Hello guys, here we from Group 9 will discuss respiratory diseases, namely asthma.
Assalamualaikum warahmatullahi wabarakatuh. Here we will explain the treatment of one of the respiratory disease, namely asthma.
Asthma is a chronic disease that affects the airways, causing narrowing, inflammation, and excess mucus production that makes it difficult to breathe. Symptoms include coughing, shortness of breath, wheezing, and chest tightness.
Asthma symptoms: 1. Shortness of breath. 2. Tightness or tightness in chest. 3. Wheezing. 4. Unusual restlessness. 5. Frequency.
Ventolin inhaler containing albuterol or salbutamol is used to relieve the symptoms of asthma and chronic obstructive pulmonary disease or COPD. Deduction: Ventolin inhaler is used to 1. Treat or prevent bronchospasm, narrowing of the airways in people with asthma. 2. Relieve symptoms of COPD, such as shortness of breath. And 3. As a drug to relieve acute shortness of breath or asthma attack. Side effects: 1. Common side effects: heart palpitation, tremors, headaches, dizziness, or nausea. 2. Less common but serious side effects: chest pain, heart rhythm disturbances, or increased blood pressure. 3. Other side effects: anxiety, sleep disturbances, or throat irritation.
Condition when asthma disease requires an inhaler. 1. Symptoms of acute asthma. When acute asthma symptoms occur, such as coughing, shortness of breath, or chest heaviness, an inhaler can help reduce these symptoms. 2. Asthma attacks. When an asthma attack occurs, an inhaler can help reduce symptoms and prevent a more severe asthma attack. 3. Physical activity. When asthma patients engage in strenuous physical activity, inhalers can help prevent asthma symptoms associated with physical activity. 4. Allergen exposure. When asthma patients are exposed to allergens that can trigger asthma symptoms, inhaler can help prevent those symptoms. 5. Weather change. When weather change can trigger asthma symptoms, inhaler can help prevent them. Ventolin inhaler dosage for adults and children over 4 years old. 1. Usual dose when symptoms appear. 1 to 2 puffs if need. May be repeated every 4 to 6 hours if symptoms persist. 2. Preventive dose. For example, before exercise. 2 puffs about 15 to 30 minutes before activity. 3. General maximum dose. Not more than 8 puffs in 24 hours unless prescribed by a doctor. If you need Ventolin frequently more than 2 days or week, it could be a sign of uncontrolled asthma and need additional therapy. Do not exceed the dose without doctor instruction. Ventolin inhaler might cause head leakage.
Things to do while and after using the inhaler. After using the inhaler, first, clean your mouth. It's recommended to rinse your mouth with water after using the inhaler. Second, check the number of sprays. Make sure your inhaler is not empty and replace it immediately if it's running low. Third, watch for signs of side effects. If you experience serious side effects such as chest pain, heart problems, or allergic reaction, contact a medical professional immediately. When using the inhaler, ensure proper inhaler technique. Exhale first, administer the required dose, inhale deeply for 5 seconds, then hold your breath for 10 seconds before exhaling. How to use the inhaler? First, stand or sit upright. Second, remove the cap from the inhaler and shake it for 5 seconds. Third, tilt your head back slightly, then take a deep breath and exhale slowly. Fourth, Place the inhaler between your teeth and close your mouth tightly. 5th, press the inhaler quickly to release the medication. 6th, inhale immediately after the medication is sprayed, then breathe normally for 3 until 5 seconds. 7th, hold your breath for 10 seconds and allow the medication to enter your lungs. 8th, wait about 30 until 60 seconds before taking a second puff.
People who have lung conditions like asthma or COPD often take their medications using a handheld device called a metered dose inhaler, or MDI. A metered dose inhaler sprays medicine through your mouth so that it can reach your airways. If your inhaler is not used the right way, some medicine may not enter your mouth, or some may remain in the back of your mouth. Either way, it may not reach your airways where it is needed. This video will show you the general steps for using an inhaler correctly. It's important to follow the instructions that came with your metered dose inhaler. A metered dose inhaler has 3 main parts: the mouthpiece cover, the plastic sleeve with a mouthpiece, and the medicine container. Before using your metered dose inhaler, remove the mouthpiece cap and shake the inhaler. If this is the first time you are using your inhaler, or if you haven't used it in a while, you may need to prime it. Check the instructions for how and when to do this with your inhaler, as they can differ depending on the type of inhaler and medicine. When you're ready to use your inhaler, stand or sit up straight. Breathe in deeply and breathe out completely to empty your lungs. After shaking the inhaler, put the mouthpiece in your mouth and close your lips around it to form a tight seal. As you breathe in through your mouth, press down firmly on the top of your inhaler to release 1 puff of medicine. Keep breathing in slowly through your mouth for 3 to 5 seconds until your lungs are completely full. It is recommended to hold your breath for approximately 10 counts. Finally, breathe out slowly through your mouth. If your medicine dose requires 2 puffs, you may need to wait before taking the second puff. Follow the instructions that came with your inhaler to know how long to wait between puffs. After using a steroid inhaler, rinse out your mouth with water and spit it out. It's important to keep your inhaler clean so that it works properly. Check your inhaler's instructions for the right way to clean it. Proper use of your metered dose inhaler may help you control the symptoms of your lung condition.